to 16,000. Although I did my research after the show and everything and in preparation for the show today, and I saw that there's in some reports, some people are saying that it's actually it's not even up to 8,000 primary healthcare centers that we have already. Some are saying that it's actually more than that. So I'm looking for the right word now. I can't find it. Conflict report. Yes. Some are saying it's not even up to 8,000. But here on Maternity Line show, SA did state that the government is increasing the current 8,000 to 16,000. Not my word, right? Now, before last week's show, the plan, there have also been a report about this same subject, on this same subject rather. I remember the coordinating minister, Federal Ministry of Health and Social Welfare, Professor Mohammed Ali Pate, did say some 7 months ago, though in financial terms, right? He did say that the federal government would invest 8,000 primary healthcare centers with the Basic Healthcare Provision Fund. That was in November. Then in another report in January, he did say that the federal government was set to disburse 50 billion to primary healthcare centers in the first quarter of 2024. First quarter was April last month, January, February, March. Okay, March. First quarter ended in March. So we should do another feature on that conversation in order to know where exactly we currently are. So let me, reason Emmanuel is here with me is for me to be able to play back for part of that conversation, not in full. You can always find the full one on social media. Please listen.
So far, we have almost 8,000 PHCs that are functional, that are providing services to vulnerable people, including pregnant women and children. So this is ongoing, but this administration is also already as trying to step up to ensure that we have additional 8,000 primary healthcare facilities across the 36 states of the federation, plus FCT.
Right, additional 8,000. The first one about 8,000. So clearly, in about 8,000 plus additional 8,000. So we are having about 16,000 primary healthcare facilities the government is planning. Right? So Lagos. Now, I'd love to ask you: Do you think that the federal government establish more primary healthcare facilities in the country, or should government equip the already established medical facilities with necessary resources required to function better instead? What do you think? Because I also did more research on this conversation in preparation for today's conversation, and I came across a research done by Budget Nigeria where I saw that there are a lot of inadequacies within the Nigeria primary healthcare facilities, let me put it that way. And I remember Dr. Salma did state last week too that there is inadequate staff, especially in the rural areas, northeast, northwest, and of course north central. Previous research also shows that northwest here, this is southwest rather, southwest here, things are a bit easier, and that is because people can afford to pay even when they have to pay from out of pocket. Even when they have to pay, that is not convenient for them. Even when it is expensive, Southwest appears to still find things a bit easier, unlike the Northeast, Northwest, and North Central. So what do you think? Should the federal government establish more primary healthcare facilities in the country, or should government equip the already established medical facilities with necessary resources required to function better? Let me call the number before I play the next one. The number is to call 0201 465 7190 0700 993 993 993. Okay, I have a caller. Good afternoon, Nigeria Info. Hello, good afternoon. Hello, good afternoon, Maternity line. Wow. Maybe you should try another line. I see your call. Thank you so much. Okay, so let me play another factor that Dr. Salma Anas mentioned.
One of the major challenges that we have is about the human resources to deliver the services. They are grossly inadequate, and most of those should be nurses and midwives, and also community health workers. So what we have done is to increase the production capacity of nurses and midwives through the National Council on Nursing and Midwifery. This has happened already, and also to attract private sectors and licensed private sectors to also contribute.
Okay, I have a caller. Good afternoon, Maternity line. Hello, good afternoon. Oh, what's going on with the telephone lines? Oh, wow. Okay, 0201-465-7190, 0700-993-99. Okay. Thank you, Mado. 0201-465-7190 is the only number available to call for now. Please do call. Sorry, you have been trying to call. Same person has been trying to call. You might want to try this again. 0201-465-7190. Good afternoon. Hello, good afternoon. Oh, please do not call 0700, okay? Do call 0201-465. I see people trying to call in, but unfortunately. Anyway, I'll take this message on WhatsApp. This is from Lord Bash. Lord Bash says, I'm looking for that message again. Lord Bash, the message came in at the time, but I will search for it. Good afternoon, Nigeria Info. Okay. Anyway, so some of the challenges that Nigeria is having right now, even as mentioned, as emphasized by essay to President Tinubu, is human resources, which is inadequate. We're talking about the midwives, the nurses, medical professionals. Yes, and we know that right now the country is experiencing brain drain because medical professionals are exiting the country, and this is not even helping us. So with that in mind, do you think what we should do right now is establish more medical facilities, more primary healthcare facilities, or should the federal government, better equip the ones that have been established already, about 8,000 of them? What do you think? Let's talk. 0201-465-7190. WhatsApp number once again. What our WhatsApp number is 0809-597-5805. Good afternoon, Nigeria Info.
Hi, Zaynab.
Good afternoon. Good afternoon.
Oboli calling from Ikorodu.
All right, Mrs. Oboli, good afternoon.
Good afternoon, ma'am. Well done, ma'am.
Thank you.
So the health facilities that we have on ground, why haven't we equipped them to, a level that if people go there, they'll be able to not only assess quality health, they'll be able to also assess everything holistically. See, the last time I was at a public health center, Zaynab.
Please go ahead. I'm with you.
The premises, the people on ground, some were not even able to attend to you very well. Do you get what I'm saying? So why bring up more hospitals when the ones we have are not properly equipped? People, they are not paid, remuneration, everything. So if we can be hands-on on this particular one we have, then every other thing will align. For now, I don't think we should be looking at producing or bringing out more health facilities, but to keep the ones on ground up to date. That's my take on this issue.
Right.
Everything just aligned, because presently we can't even access quality health care. The health providers presently, the ones we have, the little pockets of other facilities here, Mascara, the one in K2, everywhere, they should upgrade them. If they do that, I think we'll all be fine. Drugs are not cheap these days. And the people are not even paid properly. Everywhere is in a mess. Why bring up new ones?
Oh, sorry about that, Mrs. Oboli. So, Mrs. Oboli says it's best for the government to better equip the existing ones, make resources adequate instead of building more. Somebody was also trying to call in while Mrs. Oboli was on. The numbers to call 0201 465 7190. Lagos, I'll be going on a short break. When I come back, I'd love to take more of your messages. One message dropped earlier on, so I'm still looking for that message. Emmanuel, or did you delete that message? All right, Lagos, I'll be right back. Please stay here.
Only one station gives you great talk every day.
Once you have money, to have influence and power, you can rule in Nigeria. The Supreme Court said that one old man came to testify because the old man cannot lie, that they gave him judgment.
This man will embezzle the money. This is a military man. I can't even prove the NMPC the way it will be DPM.
Better to say, I will come and do my best, Nigeria. Please support me. Let's how we work together.
I am stop defending him.
I am not. I'm
defending him a lot.
If your ministers don't work, vote them out of office. If the governors don't work, vote them out of office. Well, I'm hoping that you can educate yourself enough.
I think a black man is caught.
No, don't say that.
We are suffering from post-traumatic disorder. We are traumatized.
How do you say that the world is survival of the fittest?
Hear the news, air your views, and we'll tell you what's new.
your number one station for talk.
99.3 Nigeria Info. Let's talk. Talk.
All right, so you are listening to 99.3 Nigeria Info. I am Zaynab Yakin, and this is Maternity Line. I have an ally of maternal and child health live in the studio with me, and that is Emmanuel Onwuka. Emmanuel decided to jump on this conversation. He's an intending father, I guess, a husband, and of course a father, intending father. Why are you laughing, Emmanuel?
No, I just like the way you put it, intending father. In my church, they call it potential father.
Potential father. I saw you the other time. Yes. I'm happy this is even happening. I saw you the other time in the newsroom with this little girl. You were on daddy's duty. I mean, yes, you can. You get married and you start having your kids. I have a caller before you jump on this. Good afternoon, Nigeria Info. Oh, wow. Something is wrong with the lines, I suppose. Okay, so Emmanuel, you've been listening all the way. So what do you make of the conversation between myself and Madam Essay?
Okay, so I think that it was a very rich conversation because I believe all the right questions were asked, during that conversation. But one thing I found very, very interesting is just what you said about the question you're asking currently about the 8,000 primary healthcare centers. If it's to set up more, or to equip the ones we already have. I love the way Madam Oboli put it, when she was thinking about, the lack of equipment and other, the low pay, in some places. And I think that is something that we should also consider, when it comes to set all these strategies by the government.
All right, I'll take this. Oh, I lost that call. Yeah. And I didn't want to cut off while Emmanuel was talking. Okay, the person is calling back. Good afternoon, Nigeria Info.
Hello,
good afternoon.
Yeah, good afternoon, our beautiful sister Zaynab.
Zaynab for short.
Yeah, good afternoon, Mr. Emmanuel Onwuka.
Thank you very much, sir.
I like the fact that they are staying in the studio with her to complement the program. My take is on the International Day of the Boy Child. I so much appreciate the fact that Zaynab is bringing it to the fora. Most times we, the male species of humanity, are not always recognized or appreciated. You can't imagine the other day I saw people shouting Happy Father's Day. I was like, when did it come? So everything about men most times are swept under the carpet. But I thank and appreciate Nigeria Info for always bringing most of these important programs to our understanding and to our awareness. So, Sister Zaynab, God bless you very much.
God bless you too, Merchants Man.
So by weekend, I will, like I said on the text message, by weekend I will give my boys a wonderful treat because.
Were you the one that sent that message I was looking for?
So by weekend I will give them a treat. It fell within the school days, and the only time any parent would have a time out for their children is this weekend.
Right.
So they at least for them to feel belong, like the girl children are always celebrated, at least for the boys to also feel at home that they are human beings. I thank you so much for bringing wonderful topics that educate and entertain us. Thank you so very much.
Thank you too, Merchant Man. We have another caller. Good afternoon, Nigeria Info.
Yeah, good afternoon, Zaynab.
Good afternoon.
Emmanuel, I greet you.
I greet you, sir. Good afternoon.
It's been a while. Okay, Rapuchku is my name.
Oh, Rapuchku, good afternoon. It's my first time interacting with you on Maternity line.
And I've been on with you.
Okay.
It's been a while.
Please go ahead. What do you make of the...
Okay, so you see, in the discussion with the SA
right.
on health, Mr. Bola Tinubu, the president. You see, what I suggest is let's, equip the ones we have already. Because we lack some facilities in our health, our healthcare facilities. We lack so many things. The drugs are not there. Some things that make up the health facilities. I mean, healthcare is not there. The midwives, the nurses, we lack many of them. You go to any health maternity, you stay like 8 hours before you are attended, before one will attend to you. So it didn't help matter. Let's equip the ones we have already. Let it be working perfectly okay. You go there, you get what you want.
All right.
Because before we think of, establishing more other ones. Because if you go ahead and the SA is suggesting we put another more 8,000, making it 16,000, most of them will be waste. People will use it and convert it to other things, and not the intention of what they are meant for. They convert it to playing ground and some other things. Which is not.
All right, Rapuchku, are you there? Are you there? All right. The network service provider is toying with me. My shoe. You people had better be warned. Good afternoon, Nigeria Info.
Hello, good afternoon.
Good afternoon.
This is Eze of Odogbolu.
Hi, Eze. Good afternoon.
Good afternoon, man.
Nice to have you here.
Yeah, I so much like that idea.
Okay.
Because where I come from Ebonyi State, in my place, the only thing that functioned there is the health center. We didn't have a general hospital nearby. The only hospital we have there is one Presbyterian hospital. That is the only one they managed to build for a long time ago. But this health center is the one that managed our women there for us, because we who live in a remote area, before we can take our women to where you can find even the health center, it's a very far distance. I think when they add more now, we that live in a very remote area, it can reach us. So it's a very good idea. I support that. Please let them not talk anything against that. It's a very, very good idea. Thank you.
All right. Thank you too. So we now have 2 against 1. More callers. Good afternoon, Nigeria Info. Hello, good afternoon. Good afternoon.
Yeah, I'm Mr. Sunday. I'm calling from Ikeja.
Hi, Mr. Sunday. Good afternoon.
Good afternoon. My contribution is this. If you look at our environment today as a country, you see the health issue has been a dilapidated one. We are far beyond when it comes to health matters. As a country, we are far beyond. And we that are in the urban areas, let me say we are, as it is now, we are striving. More like we are struggling to get our health stable one way and the other. Then if you go back to the rural areas, what would be the effect? It means there is no, just like what other callers are saying, there is no health at all. There is no hospitalized hospital that we even said, okay, let us use it to assist or in the local government or any other places. So and coupled with all these things, people are easily affected with kind of health conditions and different kind of complaints on health issues. And talk more of a woman who is pregnant, who needs a very wonderful and beautiful health care, and all these things are lacking in our environment. So how would our environment look like? So those are the things that at times we called on radio so that the government will listen to us and also contribute to the health effects that we are passing through in our society. At least with that, it will help us as a citizens to go beyond when it comes to antenatal or health care attention.
I understand.
So I think to that, I'm supporting that, but I just hope that government should have ears for us, and I also do that which is needful for us. Thank you.
All right, thank you so much for your contribution. Good afternoon, Nigeria Info. Oh, sorry about that. Sorry, apologies. Okay, so some people are saying more primary healthcare centers should be established, while some others are saying the ones we have already should be better equipped. All right, we are still on that conversation. About a year ago, I think some 7 months ago, there was a report which says about 25% of the primary healthcare centers are functioning in the country. 25%. And then that report says about 80% of the facilities are still non-functioning. 80%. With that, do you think government should establish more primary healthcare centers or should better equip the existing ones? Good afternoon. Hello, good afternoon, Nigeria Info.
Emmanuel on the line.
Emmanuel, good afternoon. Please speak a bit louder.
Okay.
You appear to be far away from your...
Can you hear me now?
Yes, very well. We can hear you.
Primary health care should be built maybe in those villages, those rural areas, those places that don't have, not in the cities, because we have more in the cities. But those places that they already have one or two, they should build more of it there so that it will help women. So that's my take. Thank you.
All right, thank you so much. And women, what happened? Why are you not calling in? Let's see. This might be a female caller. Good afternoon, Nigeria Info.
Hello, good afternoon.
Good afternoon.
Yeah. My name is Chris.
Oh, your line isn't clear.
Hello, my name is Chris. Can you hear me?
Hi, Chris. Good afternoon. Yes, we can hear you very well.
Okay, my take is, you see, government should build more. Let them build more. There are a lot of towns and villages. We have about 200 and something million people. Let them build more. And equip the existing ones and the new ones. It doesn't take much.
So,
in fact, if what this government does, I would appreciate. They should cancel all these roads they want to build. Use the money to build facilities. Equip existing ones and build more.
So do you think for you it's about the numbers, it's about having more or making more functional the ones that have been established already?
Both because, when you are sick, once I visited the general hospital level here, come to there.
I'm sorry, as much as I would love for us to have this conversation, your line isn't clear. Please do try again if you can. Thank you so much. All right, it's Maternity line, and Kemi has a message for Lagosians. Please stay here. We'll be right back.
If a leader that is not informed is bound to be deformed.
So many organizations don't even have a workplace sexual harassment procedure or reporting channel. So if there's no place to even report, how do I even report these issues?
AstraZeneca and Moderna vaccines cannot be mixed.
You cannot say bring that one too.
I cannot say bring that one too. Make I just manage them. No.
99.3 Nigeria Info.
Lagos, attention all kids and families, get ready for a day of fun and excitement as we celebrate Children's Day at Fun Factory Amusement Park. Yes, join us on the 27th of May at number 10 Lai Yusuf Crescent off Admiralty Way, Lekki Phase 1, Lagos, for unmatched fun, games, activities and surprises. From face painting to treasure hunts to dancing chairs, there's something for everyone. Happiness is contagious and unforgettable memories would be created. So come one and come all, let's make this Children's Day one to remember. Fun Factory, where every child's dream comes alive and every day is an adventure of fun. Lagos, please do not forget that there is money to be won here on Nigeria Info. Okay, it's a winning spree here on Nigeria Info with oneplay.ng. Today is Jackpot Friday, so if you didn't win on the Money Crossfire and WhatsApp Lagos, you can still win money. Okay, there's game on shows and there's money to be won on weekend as well. How do you participate in all this? It's so simple. All you need to do is grab 500 naira and go to the website www.oneplay.ng or just dial *347 *880 *3#. *347 *880 *3#, or go to the website. It's easy peasy. Pick your station, Nigeria Info, and play. The more you play, the better your chances of winning. Don't say I didn't do anything good for you. Remember to play responsibly, and also remember that if you've been playing since Monday and you've not won, well, you're automatically qualified for the weekly jackpot that's happening today. So still play a game, because you don't know if it's the one that you play today that will enter. I wish you good luck.
Mental Sports, Mental Sports, Mental Sports. A new and unique kind of sporting event is in town. How fast and accurately can you answer a factual math question like 34 multiplied by 81 divided by 12 without a calculator, paper, or pen? Children's Day Great Mental Sports Bonanza is a fun, game, and competitive event fashioned to make youngsters in upper primary, junior, and senior secondary discover and grow their mental calculations and active memory abilities whilst having fun and winning lots of prizes and medals. Watch greatness perform live and learn new tricks from him. Lagosians, go to www.greatmentalsports.com to register. Build your mental muscles by participating in the quiz session. Participation is free. The venue will be sent by email. For sponsorship, please call 0706 085 0698 or send an email to antonio@greatmentalsports.com. Media partners Wazobia FM and Nigeria Info.
Who says you can't have it all with one play?
I got that defined point. You have just won yourself.
Congratulations.
Hello, good morning.
Yes, Melitus. One player, don't talk to two players because you won 20K.
So now you won yourself 20,000 naira. My name is Well Done. Okay, well done. You want to tell you well done? You won yourself 20,000 naira.
With 500 naira, you can play to win big. From 120,000 naira to 190,000 naira daily on Nigeria Info. Go to oneplay.ng and play with 500 naira. And in a few seconds, your ticket is in the draw. Or dial *347 *880 *3#. Win daily on Nigeria Info. 50,000 naira on Money Crossfire. 60,000 naira on WhatsApp Lagos. 20,000 naira on Sunnyside. And 60,000 naira on Game On. So Lagos, what are you waiting for? The more you play, the better your chances of winning. Remember to dial *347 *880 *3#. Play responsibly. Not suitable for persons under the age of 18.
Ladies and gentlemen, Football Fan Festival in Nigeria is back. It's Goal Fest 2024, Featuring exhilarating games, food, comedy, live music by some of the Nigerian musician superstars. And you can watch the UEFA Champions League final on a super huge screen. Goalfest 2024 will take place on the 1st of June at the Balmoral Convention Center, Federal Palace Hotel, Amadabella Way, Victoria Island, Lagos. Time 12 noon. Limited tickets available. Get your tickets now at www.goalfestnigeria.com or at 267A at Timian Crescent, VI Lagos. Goalfest 2024 is powered by Femi and the Gang and Football Republic. Proudly refreshed by Pepsi. Ladies and gentlemen,
Boys and girls, introducing the first of its kind in Nigeria.
the first radio just for kids. It's here at 101.7 Kids FM.
Are you serious?
Oh, yes.
It's going to be fun for kids on your airwaves 24/7.
Talking about from exciting games
Check.
to juicy gist
Double check.
and great music.
Super check.
All these and more on your number one PlayStation 101.7 Kids FM.
Don't be the last to join the train. Download the Kids FM app on your iOS or Play Store today and stay tuned on the go.
You can stream on our website at kidsfm.ng.
You can also follow us on all socials at kidsfm.ng and stand a chance to be one of the super kids.
On 101.7 Kids FM. Remember, it's no dull moments on Kids FM.
So tune in and stay locked on 101.7 Kids FM.
Let's play.
You are listening to your number one station for talk.
Your number one station for talk.
99.3 Nigeria Info. Let's talk.
Almost 8,000 PHCs that are functional, that are providing services to vulnerable people, including pregnant women and children. So this is ongoing, but this administration is also already as trying to step up to ensure that we have additional 8,000 primary health care facilities across the 36 states of the federation, plus FCT. One of the major challenges that we have is about the human resources to deliver the services. They are grossly inadequate, and most of those should be nurses and midwives, and also community health workers. So what we have done is to increase the production capacity of nurses and midwives through the National Council on Nursing and Midwifery. This has happened already, and also to attract private sectors and license private sectors to also contribute.
This is
Maternity Line.
Maternity Line.
'Whether you like it or not, it belongs to them and their family.
Your number one station for talk. 99.3 Nigeria Info. Let's talk.
3 Nigeria Info.
99.3 Nigeria Info. You're listening to the news update this hour. The Vice President Kashim Shettima is chairing a high-level dialogue on advancing the gains made within the first year of the administration of President Bola Tinubu. The event is part of the administration's efforts to leverage international cooperation in delivering
99.3 Nigeria Info. We are more than just radio.
Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk. 99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3.